Okay, guys. Hello. Good afternoon. So right now it's Saturday, 2:30 p.m. So it's Black Saturday. And hello, guys. How are you? I'm thinking about you and I miss you. Um, mag-aral na lang tayo, ha? So we need to continue our discussion. So get your notes, get a drink, sa inumin ko, and aral tayo. So today, guys, is Unit 7, Capillary Puncture, Equipments, and Procedure. So, sana hindi ko na ito i-discuss eh. I'm just going to show you videos, pero sige, i-discuss ko kasi I want to emphasize a couple of things because class, capillary, kasi baka pag hindi ko diniscuss, baka isipin nyo hindi mahalaga. Kasi class, mahalaga ang capillary, getting capillary samples or micro-sampling. So we get it through skin puncture. We are puncturing capillaries. Um, Guys, magsimula tayo sa indication. I think, hindi ko alam kung nasaan banda sa handout nyo, pero gusto ko na lang muna i-establish the value of getting capillary sample. I know this is not as much as exciting as doing a venipuncture. We're just going to do a finger puncture class, very quick, simple, tapos na in a couple of minutes. But class, it's very important because number one, it is good for getting blood among patients with fragile veins. Sino ba ang mga may fragile veins among newborn, geriatric patients, chemotherapy patients, class, burn victims, class, yung mga nasunog. How could you even find a vein in there, diba? Na-try ko na class mag-extract sa isang burn patient. Grabe, the smell, ganyan, the smell, and they are very prone to infection. Nasunog siya, yung pasyenteng yun, kasi he was electrocuted, ganyan. And actually, hindi ko siya inextrakan. Kasi I was scared. Ganyan. And I was an intern back then. So, ayun, in-endorse ko sa 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 head namin. Hindi rin siya naka-extract. Hindi ko alam kung paano ginawa niya. Capillary puncture, I think, is the best since if you cannot access the vein. Next, inaccessible vein. So, aside from burn victims, sino pa ba? So, people who have IVs, ganyan. People, example, capillary puncture um, when I was an intern rin, merong nasaksak na pasyente, ganyan. So, kasi pag ganang mga nasaksak, actually, sobrang busy na yan eh. And a lot of medical professionals are around the emergency room, ganyan. Lahat sila may ginagawa dun sa pasyente, ganyan. Tapos biglang medtech, may mag-extra, ganyan. And venipuncture is very hard to do, mas lalo na pag blood typing lang naman. So, yeah, let's just do a um, capillary sample for newborns class. Example is for newborn screening. Newborn screening. Yan, i-discuss ko yan later. Next, and to prevent iatrogenic anemia, because we shouldn't be getting so much volume of blood for from babies. Next, for point of care testing, POCT. Ano ba yung mga point of care testing or bedside testing? Like, testing for glucose, di ba? Di na kailangan mag-extract. Puncture na lang. And patients prone to thrombosis or who are prone to clotting, ganyan. So, some patients who are prone to clotting, it's very dangerous if you will extract from deep veins. So, yun. Capillary puncture na lang. So, class, here are your lancets or incision devices. So, yung pinakauna dito, this is called your lancet. Ito yung isa sa pinakagusto ko kasi you can get high amount of blood, high volume of blood compared to others. This is your feather lancet. And class, itong second one, ito class, it can be placed on a dispenser. dispenser ba, retractable lancet device, pwede mo siya ipasok. But as you can see, look at the needle, it's so thin. I think this is best for point of care testing. And class ito, third one. Itong tatlong to, so some lancets are in this kind of device, and actually you just throw them. Yan, tapon nyo na lang rin sa still sa red container. Next class, ito cool to, laser lancet. So class, through a laser, yan, especially among children with diabetes, ganyan, parang ayaw mo nang ipakita sa kanila yung needle, so they will just place their finger in front of that gun, tapos ayun, it will make an incision on your finger through a laser. Ang galing, no, class? So its advantage is less use of needles, no sharp needle injury, no needle stick injury. Yan. So, ang marami class, iba't ibang forms ang heel puncture lancet. Ang cute ng mga paa. Yan. But, sobrang kawawa yung mga baby class. Yan. So, class, among neonates, among babies, especially if they're not walking yet, we extract on the heel. So, what else? Micro collection container. So, since this is micro collection, di ba, cute rin ng mga lalagyan natin. So, cute, diba? And class, what else? So, we have containers, we have micro vacutainers, and micro hematocrit tubes. Itong mga tubes na to, parang like glass straws sila. So, we can obtain the blood from your capillary through this tubes, microhematocrit tubes. So, from that term, microhematocrit, we can use them for hematocrit testing, for getting the packed cell volume. So, isil mo lang using a clay and a paraffin, tapos place it in a centrifuge, spin it for about 10 minutes, then you have your results for my hematocrit and read it using a microhematocrit reader. Yan, diba? Instant. Yan. So, to just give you an image dito. So, if you want to collect your EDTA tube, ganyan. So, para mas madali, class. So, merong tube that connects the tube and the blood. So, nilalagay yan sa tube. Ganon, para hindi makalat. So, here, class, I just want to, meron dito sa baba, yung Cryosil, ayan, brand yan. So, it's just a clay sealant for the microhematocrit. So, class, apparently, actually, ngayon ko lang ito alam, meron pala tayong capillary blood gas equipment, CBG capillary blood gas. So, kasi capillary is like, is more similar to arterial blood. So, yun, capillary blood gas equipment, especially among babies. So, I was searching for capillary blood gas equipment. Ito yung mga nakakita kong images, class. Ganito yung itsura niya. So, ayun, aside from that, we use slides for making peripheral blood smear and warming device. Wala akong nakitang warming device. Okay, so your capillary, class, are thin, are the thinnest part of your your vasculature. So your capillary is where your veins and your arteries tends to meet. Dun sila nagmi-meet, dun naghahalo ang vein at saka artery. So that is where the gas exchange happens. So class, anong laman ng capillary blood? So it contains arterial blood, venous blood, and capillary blood. Tatlo ang laman ng capillary, naghahalo na doon lahat. And aside from that, class, once you will injure or puncture the skin, you will release interstitial fluid. So, fluid in between your cells. Yan, interstitial and intracellular. fluid in between your cells, and fluid inside the cells. So that's the composition of capillary specimen. Ang rami ng laman, class. So your capillary blood tends to be more diluted. Yun. So it tends to be more diluted. So expect that the hemoglobin, hematocrit, and RBCs are lower, and WBCs, platelets, and glucose tends to be higher in capillary specimen. So may mga difference, class. So your WBCs are higher due to chemotaxis. Kasi, class, kung may injury, the cells in your skin produces cytokines or cell signals which promotes the migration of WBCs to the site of injury. We call it chemotaxis. So nagmamigrate yung WBC site of injury, so expect it to increase. Class, platelets are higher, yes, because when there is injury, the platelets go into the site of the injured area. So yeah, WBCs and platelets are increased due to the injury, because after na nun is platelet activation na, kung naalala nyo sa hemostasis, and WBCs are there because of chemotaxis and phagocytosis. So the hemoglobin, hematocrit, and RBCs are lowered because of dilution, and glucose tends to be higher. Class, ang raming use ng capillary samples, however, they have limitations. So number one is you cannot use them in ESR tests or erythrocyte sedimentation rate. So class, ito yung image na yon, erythrocyte sedimentation rate. Di ba sabi ko, nalala nyo ba, anong tube ang ginagamit sa erythrocyte sedimentation rate? It's black. Diba? Sodium citrate tube. So, ewan ko bakit ganun yung color nila. So you will place a Westergren tube inside the citrate tube, tapos it will go up. And so through capillary movement. So tapos after 1 hour, you will see how fast the red blood cells settle at the bottom. So, ganun. Erythrocyte sedimentation rate, it's a test for infection. So, the lower or inflammation, the lower the sediment, it can pertain to inflammation. Coagulation studies, class. Anong tube ang coagulation studies? Light blue, diba? So, it's better not to use capillary sample for that blood cultures. Masyadong konti. And tests that require large volumes of serum and plasma. Order of draw. So first one is CBG. Second one, class, are the one with ADTA and additives, so mga anticoagulant. Why? Because class, kailangan mo muna, kasi pag patagal, mas prone sa clot. So, unahin mo muna yung may mga anticoagulant. So, blood gas specimen, EDTA specimen, and other additive specimen, last ang serum specimen. Yan. Kasi medyo mas prone na sa microclots yung mga huling tubes na lalagyan ng capillary sample. So now, class, we have capillary puncture steps. So I just want to emphasize a couple of steps here. So step 1, review and accession test request. So excited kayo mag-capillary puncture, hindi pala capillary puncture ang kailangan, di ba? So review, so read your requisition paper, approach, identify, and prepare the patient, verify diet, restrictions, and latex sensitivity. Step 4, sanitize hands and put on gloves. Class, so I was reading pala your quizzes. Naalala nyo, yung the step-by-step different steps on venipuncture. I think, class, most of you got the basics right. Tama naman, patient identification and the like. Pero class, siguro nakalimutan nyo lang yung where to place your tourniquet, diba? 3 to 4 inches above the antecubital fossa. What vein? Parang hindi naman sinabi kung anong vein ang Tapos how to palpate, ganyan. Ano pa? Class, so far, ilan lang, siguro mga 3, 4 lang ang nag-identify ng angle ng needle once you're going to extract, and make sure the bevel is up, diba? 15 to 30 degrees in angle, then make sure the bevel is up, then insert it. Yan. So, parang mga ganon. So, position the patient. So, depending if you're going to puncture the finger or the foot of the baby. So, if it's adults class, so we use the finger middle, the middle or the ring finger. Pero class, I prefer the ring finger. Kung what's best, class, ring finger. Yan, mas less yung mga nerve endings. And class, sa may lateral area, yung side na mas malapit sa pinky. Doon kayo, dito, wag sa gitna. Yan. Yung side na mas malapit sa pinky, lateral area, doon mas okay mag-extract because it has less nerve endings. And class, so mali pala tong image na kinuha ko sa position the patient kasi tinan mo guys, so in-extract sa may index finger. But so position the patient and position yourself. Alam niyo class, meron akong nakita mga medtech na capillary puncture na sila, tinalikuran nila yung pasyente. Yung parang they were holding the finger pero nakatalikod sila sa pasyente. Siyempre, dapat you have to look at your patient to see if they have any reactions, ganyan. And the baby class, they should be lying down. Siyempre, yung mga baby, hindi pa kayang tumayo or umupo. So, select the puncture or incision site. So, make sure the skin is warm, pink, and normal color. When I was reading it, medyo natatawa ako kasi make sure the patient is alive, basically, diba? And the finger is alive. No scars, cuts, bruises, rashes, cyanosis, edema, and infection. So, the same thing with your venipuncture class. Choosy tayo. We don't just extract in any finger, 'di ba? You have to assess if the finger is healthy, sabihin na natin, 'di ba? So, kunyari may rashes, ikaw rin medtech, ikaw rin baka mahawa ka rin, 'di ba? So, you have to check na kung may ringworm, ganyan, fungal infection, 'di ba? You have to check. So, for adults and older children class, children who can already walk. Yan. Siguro class yung adults, hindi na tayo nag-extract sa paa noon. Matitigas na yung mga paa, di ba? Mga kasukasuhan. So, palmar surface. So, when we say palmar surface, dito, palmar. Palmar surface of distal or end segment of middle finger of non-dominant hand. So, it's better to not extract on the non-dominant hand, ganyan. And because we don't want to induce any pain. So, kaliwete kasi ako class. So, yung non-dominant hand ko, right? So, distal end or segment of middle or ring finger, yan. Palmar surface of the ring, distal end of the ring, or middle finger of the non-dominant hand. So, sa baby's class, sabi niya, lateral or medial plantar side of the heel. Class, kung saan yung best, tatanungin niyo ako. Class, in line with the little toe, doon tayo mas maganda. So, yung naka-shaded part dito, yung shaded part. So, I suggest that you will extract on the little toe. Pero kahit saan naman dyan. So, kung saan naka-shade, doon tayo nag-extract. So, class, I think I have a photo. Yan. Warm the site if applicable. So, because it will facilitate more blood flow, cleanse the site with alcohol. Prepare your equipment and puncture the site and discard the lancet. So, class, since pag ganyan na, pag automatic na yung lancet natin, you don't have to check the fingerprints kung saan ka tutusok, but it's best to puncture against the fingerprint or perpendicular to the fingerprint, class. So, you should go against the fingerprint. Mas lalo na kung feather lancet yung gagamitin niyo. So, ito class, gusto ko yung tama yung hawak niya dito sa paa ng baby, ganyan. So, you have to steady the finger of the baby. Yan. So, here sa adult naman, you can hold the hand, mas lalo na pa kung bata, diba? It's better that you will hold the hand of the patient. Baka galawin niya eh. And class, the thing that's very unique about capillary puncture is we wipe away the first drop of blood. We wipe away the first drop of blood. Why? Number one, to remove the tissue fluid. Kasi class, kung naalala nyo, tissue factor or the tissue fluid will activate your clotting. So you have to remove it to decrease the chances of clotting. Number two, remove dead epidermal cells. And three, to facilitate the free flow of blood. So class, huwag kakalimutan yan. We wipe away the first drop of blood. Sabi na ba, kailangan ko i-discuss to kasi ito yung mga gusto kong emphasize. And filled and mix the tubes and containers with order of draw. Ma'am, I can see in the hematocrit tube maraming spaces. Okay lang ba 'yun? So you can see class, dun sa in-extract niya may mga spaces. Actually class, mawawala naman yung space 'pag centrifuge na natin. Pero mas maganda 'pag konti yung air in between your blood. So may technique 'yan. So, fix and mix the tubes and container and follow the order of draw. Ito class, wala siyang tube diretso. Kinatch na lang. So, place the gauze and apply pressure or place the band-aid. Label the specimen. Check the site and apply bandage. Dispose of used and contaminated materials. Thank the patient. Remove the gloves and sanitize hands. Transport specimen to the lab. Grabe, alam nyo, I was treating Balayer because talagang yung iba memorize lahat ng step na nasa PowerPoint and good job guys. Pero kasi, 'di ba, memorize madali lang eh. Pero kung ano yung naintindihan nyo, yun yung hinahanap ko. So class, what are the other important functions for your capillary puncture? Class, gusto ko tayo i-discuss. Newborn screening. Newborn screening. Class, it's under our Republic Act 9288 that every Filipino child who is newborn in bagong silang class, lahat sila, you have to check them for newborn screening. Yan. Why, ma'am? Because we want to detect metabolic and congenital disorders which may lead to retardation and death if left untreated. Yan. So, class, pagkaanak ni baby, yung mga nurse kakausapin or yung doctor kakausapin yung parents. So, class, to test for the 6 most common metabolic diseases here in the Philippines, the parents just have to pay 550 or I think it's already covered by PhilHealth. Yan, 550 pag 6 lang na test. And I think it's 1,500 if you want to test for the 22 metabolic disorders. Alam niyo ba, class? Kasi itong mga example, phenylketonuria, glucose 6-phosphate dehydrogenase galactosemia. Ito na lang, galactosemia, madali lang. So patients with galactosemia, they lack the enzyme that will break down galactose. Yan. So, wala silang enzyme nun. So, ibig sabihin, pag yung baby, they're intaking or eating food with galactose, like milk, ordinary milk, galactose can accumulate in their body and it can cause retardation and even blindness. So, if they are tested very early on, hindi na kailangang, the baby can live a healthy life. Ganon. So, sobrang ganda nito, class. So, we can prevent congenital hypothyroidism, congenital hypothyroidism. So, if I'm not mistaken, is this cretinism? Next, congenital adrenal hyperplasia, yung adrenal gland. So, there is excessive growth of cells, hyperplasia eh. Phenylketonuria, glucose 6-phosphate dehydrogenase deficiency. Class, mahirap to, tinuturo ko to sa hematology. This deficiency oxidizes your hemoglobin and makes you more prone to hemolytic anemia. Breakdown of your red blood cells, may mga nagtanong pala sa akin, "Ma'am, nakalimutan ko na yung tanong, pero may mga sakit ba na" tama ba? Basta may nagtanong na 'pag may hemolytic anemia, 'pag inextrakan mo, automatic na hemolyze yung blood na makukuha mo. Yes, 'yan. When a person has hemolytic anemia, example ito, G6PD deficiency, it makes you more prone to having hemolytic anemia. Galactosemia and maple syrup urine disease. Class, literal promise, maple syrup yung ihi nila, parang maple syrup, gano'n. So, 'di ba, ang cute-cute nung baby, oh. So, 'yan, we want to ensure that they are healthy through newborn screening. And we get the specimen through capillary puncture. Actually, class, nurse ang gumagawa nito. Don't know why. So, 'yan, tapos they place it, I think, in an envelope and send it to a newborn screening facility. And what else, class? We use capillary puncture to make peripheral blood smear. So once you have perfect na your phlebotomy, your capillary puncture, the next is making a smear na. Ayan. So we're finished with our discussion, class. So blood smear preparation, paano yan? Pakibasa na lang. And we're done. And I'll see you guys for the next discussion. So sana sagutan niyo yung mga quizzes na prepare ko na sa Google Classroom, and I'll see you soon. Bye-bye!